I'm pleased to be joined today on Health Beat by Dr. Emma Mirch, an obstetrician gynecologist with Faith Regional Physician Services, OBGYN in Norfolk. And today we're talking about infertility. So Dr. Mirch, talk to us about this condition.
So infertility actually couples, it's about 15%, so 1 in 6 of people will have problems with infertility. I think it's really important to kind of know that to fully define infertility, we say 12 months of trying under the age of 35, or about 6 months of trying over the age of 35. And if you're over the age of 40 and trying to get pregnant, coming to see us sooner so that we can start the workup. I think people don't realize the workup all begins with history and physical, really talking to you about how your cycles are and determining if you're ovulating or if there might be a problem with the sperm or with your uterus in general. We start kind of by doing day 3 labs, so that'd be your 3rd day of your menstrual cycle, and then we would also have you come back between days 5 and 9 for an ultrasound to assess your gynecologic organs. And as we progress, then we would start talking about if there's any abnormalities we find that might need a higher specialist like a reproductive endocrinologist, or we would also sometimes help with ovulation induction in our clinic or intrauterine insemination called IUI. So there's a lot of things that we can do in our clinic before having to refer to a specialist, which I think a lot of people don't realize that we can help keep costs down and help their reproductive needs if they need.
So are you seeing more infertility now in folks under 35?
I wouldn't say that we're seeing more, but I would say that the age of people trying to get pregnant has been going up due to careers and great things. And so that has caused us to see more people with infertility after age 30. But I don't think it's in higher prevalence. I just think people are trying to start families a little later than they used to with their career goals. And so we're here to help their career goals and their reproductive goals.
So conversely, folks that would be over the age of 35, are you seeing that being a little easier to handle now than it used to be?
I think we're screening and finding those people a little faster, and so we're able to start the reproductive workup faster.
Okay. That's great information for our viewers. Thanks a lot.
Thank you.
Okay. And that's Health Beat, brought to you today by Faith Regional Physician Services.